Hi everybody, we're going to start with a review on respiratory acidosis and alkalosis, and then we're going to move into some practice problems together. So just want to talk about what is considered normal in terms of blood pH values. We know that blood pH values should be between 7.35 and 7.45. In terms of oxygen levels, the ideal situation is to have 80 millimeters mercury of oxygen in the blood or higher. That's in an arterial blood gas sample. We call that an ABG for an arterial blood gas sample. Technically, hypoxia occurs below 60 millimeters mercury, and you have to hit 60 or lower in order for the chemoreceptors in the aortic arch or in the central nervous system to notify the respiratory center that there is a problem with oxygen. All right, and then carbon dioxide levels are ideally found between 35 and 45 millimeters mercury. I just want to make sure we tie all this together. Carbon dioxide is directly related to the number of hydrogen ions in the bloodstream, and the hydrogens directly drive the pH. So let's think of it this way. If I increase my CO2 levels, what's going to happen to my hydrogen ion levels? I'm going to increase the hydrogens because they're directly tied together. The more hydrogens you have, the lower that pH goes. Okay? Let's think of this. Let's say the less carbon dioxide you've got in your bloodstream, directly related to the amount of hydrogens, so you're going to have less hydrogens. The less hydrogens you have in your bloodstream, the higher that pH goes. Okay? So that's just how you want to think about this stuff. Now, this is all normal information here. What we're going to do is talk about how breathing or respiration rates can change these normal blood values. All right, so let's talk about hyper and hypoventilation for just a moment and how they can drive changes in blood chemistry. We know that hyperventilation is breathing too fast. That's faster than around 12 to 15 breaths per minute in an adult. Okay, so if you breathe faster, then you remove more of which gas from your bloodstream. Okay, you get rid of more CO2. So we say the CO2 levels decrease. We just got through talking about the relationship here. If you lose your CO2 by breathing them out more quickly, you lose hydrogens, and what happens to your pH? Your pH will go up. Okay, so this is cause and effect. If I breathe faster, this is what will happen to my blood. Okay, the only thing I haven't put in here is oxygen levels. The faster I breathe, the more oxygen levels I'm going to have in my blood, the higher the oxygen levels will be. Let's also do hypoventilation. If I breathe more slowly for whatever reason, I'm going to retain more CO2. What's the relationship between CO2 and hydrogen? It's a direct relationship, so I'll also have more hydrogens. The more hydrogen ions I have, what happens to blood pH? Becomes more acidic. Okay, so just to be clear, let's write the word acidic here and the word alkaline up here. And again, the slower you breathe, the less oxygen you can get into your bloodstream. So I know it's tempting to memorize this, but I would really encourage you to walk this through and talk it through, because if you memorize it, all it takes is a little bit of confusion and then you get the whole thing backwards. So you want to just use common sense of saying, okay, what happens when I breathe too fast, or what happens when I breathe too slow? These are the changes that we expect to see in our blood chemistry. All right, so completely switching gears. We can use the respiratory system to help compensate for problems with blood pH, with CO2 levels or hydrogen ion concentration in the bloodstream, and also with oxygen levels in the bloodstream. Let me repeat this. It's really important that you see that we have now transitioned from just talking about cause and effect to using the respiratory system as a way to compensate for problems in blood chemistry. That means your respiration rate may increase or decrease to help maintain proper levels of CO2, oxygen, or the blood pH. Okay, so take a look at these problems here. If you have too much CO2, we call that condition hypercapnia. We know that's above 45 millimeters mercury. If you have acidosis, that means a blood pH below 7.35. That means you have too few hydrogens. Or if you have hypoxia, that's low levels of oxygen below 60 millimeters mercury, any of these three conditions can notify your chemoreceptors. The chemoreceptors are sitting in your aortic arch and in your central nervous system in the brain. When those chemoreceptors send a signal to your brainstem, your pons and medulla, that respiratory center will increase respiration. So you will hyperventilate as a way to compensate for one of these problematic blood chemistry problems. It's really important to notice my three problems here. These are not normal. These are all abnormal problems, and you can fix them by changing the rate that you breathe. Okay, so if I've got any one of these three problems, hypercapnia, acidosis, or hypoxia, the nervous system's solution for this problem is to hyperventilate. Okay? Likewise, if you happen to have the opposite three problems, hypocapnia, alkalosis means your blood pH is where? Too high or too low? Too high. And hyperoxia meaning too many oxygen molecules. In these three scenarios, any one of those three will stimulate a chemoreceptor. They're in your aortic arch, they're also in your brain, your central nervous system, and this time we'll hypoventilate. Okay, and that's a way to fix these blood chemistry issues. So let me repeat. What we're moving into now is a way to use the respiratory system and your breathing rate to help change pH problems, oxygen level issues, or CO2 level issues. You know, as a healthcare professional, you may walk into a patient's room and watch them hyperventilate. And you say, what's going on? Why are they hyperventilating? And so we can backtrack and realize that there are certain things that will cause you to breathe faster to compensate for blood chemistry issues, or in some cases you'll breathe more slowly to compensate for those blood chemistry issues. All right, so this slide here just reiterates what we just talked about. When your CO2 levels drop below 35, when your pH goes above 45, or if you have too much oxygen above 100 millimeters mercury pressure, any of these three things can stimulate or depress the stimulations for the nervous system, and the respiration rate will slow. I'd like to walk you through several problems, and what I encourage you to do is, as we read through the problems, pause, go ahead and work out the answers on your own, and then resume this video once you've had a chance to think through the practice problems. Just simply listening to me work you through these is not the same as you getting the experience of practicing them on your own. So at this point, I would encourage you to pause this video, go ahead and see if you can answer this question, and when you're ready, we'll resume with the answer on the next slide. Okay, so what we're looking at here states there's a problem called metabolic acidosis. We know what acidosis is, right? That's when the pH is too low, and what could cause it to be too low? Do we have too many hydrogens or too few? We probably have too many, okay? And the reason we use the word metabolic here is because it has something to do with the body's metabolic activities. All right, so thinking back, let's not even read the answer yet. If my pH is too low and I have too many hydrogens, that's my problem. Then my solution is going to either be increase respiration or decrease respiration. Okay, and so what I want to do is I want to get rid of those hydrogens. And although I can't necessarily blow hydrogens off in my exhaled breath, I can do that by increasing the loss of CO2. So I want to blow out more CO2 every time I breathe. How do I do that? I'm going to increase my respiration rate. And do we call that hyper or hypoventilation? We call that hyperventilation. Let me show you a really neat and easy trick. Notice over here is my problem. My pH is too low. I always compensate by my respiration rate moving in the opposite direction. Okay, so because here I have a problem of acidosis, the solution is going to be to increase the respiration rate. Let me repeat, I can't blow out the hydrogens, but I can get rid of CO2 by breathing faster. I know there's a direct relationship between CO2 and hydrogens. The faster you breathe, the more of those CO2 molecules and hydrogens you effectively get out of your bloodstream. Okay, so somebody who has acidosis and it's metabolic in nature, the compensation or solution is to breathe faster. Okay, hyperventilation. All right, I hope you're with me so far. So far, so good. All right, once again, I would encourage you to pause here and go ahead and work out the answer to this question. Again, there's a lot of information here, but what I'm looking for is this. We've got a person who's got alkalosis. Once again, metabolic means that there's something going on with the issue of metabolism here. But our main focus is the fact that alkalosis means the pH is too high. Okay, so I'm going to come down here, I'm going to identify my problem. And you'll read here and see that it has to do with diuretics. Some diuretics make people lose too many potassiums in their urine. So that's something a little for later on. But what we're focused on right now is the fact that we've got an alkalosis condition. So what does that mean about the hydrogen ions? Do I have too many or too few? It means I have not enough hydrogens. So my solution has to do with either increasing or decreasing the amount of carbon dioxide in the bloodstream. We know that if I need more hydrogens, I need more carbon dioxide. They're linked together directly. So my solution is to change my respiration rate so that I keep more carbon dioxide. So should I breathe more quickly in this situation or more slowly? This time we're going to decrease that respiration rate. That condition is known as hypoventilation. Okay, so hypoventilation will cause you to retain more hydrogens, more carbon dioxide, and the blood pH will be restored back to normal. All right, once again, let me let you read this one and pause and work on it. Resume with me in just a moment when you're ready to look at the answer. Okay, so in this condition, let me go to the answer slide. We are looking at another case of alkalosis. And I just want to mention to you that vomiting removes hydrochloric acid from the digestive tract. So that means we're getting rid of it through vomiting. That also means that we're losing it from the bloodstream. So we're also losing hydrogen ions from the bloodstream. In effect, that's like losing CO2 from the bloodstream. All right, so in this situation, alkalosis means that we have less hydrogen ions, and that is our problem. Low pH, high pH, low amount of hydrogens. Our solution or compensation is what we're looking for. And the way to maintain more hydrogens in the bloodstream is to decrease respiration. Okay, so if the respiration rate will lower through hypoventilation, that means we keep more CO2 and in turn more hydrogen ions. All right. Here's our next practice problem. I'll let you read about this one. So you may want to pause here. All right, so this time you'll notice our problem is a case of hypoxia. First of all, mountain bike riding we're going to assume there's less oxygen up in those hills. And we know that the issue here is decreased oxygen. Let me make a point here. There's no problem with CO2, no problem with CO2, no problem with pH, no problem with hydrogens. Okay, no problem with those. We are only focused on oxygen levels. Okay, and so you'll notice the solution here is for this person to hyperventilate. The solution helps us to bring more oxygen into the bloodstream as fast as we can, so we increase the respiration rate as long as we're experiencing a oxygen debt. Okay, so once again, you don't have to have a problem with all blood chemistries. This case just is an issue with oxygen levels. All right, and here's another one for us. I'll let you pause and work on this one for just a moment. All right, so a couple of things you may want to notice here. Diabetes mellitus is a common condition that causes ketoacidosis, especially in those type 1 diabetics. That word, acidosis, is what drew my attention. So with acidosis, the problem is a pH that is where? Too high or too low? And what does that tell me about the hydrogens? Too many of them. That's the same thing as saying we have too many CO2s. So the solution is we want to get rid of as many CO2s as possible, and the way that you do that is to respire or breathe faster. Now, how does that help you? That gets rid of CO2, and if you get rid of CO2, you also get rid of hydrogens, okay? And then that will bring your blood pH back down. So remember our trick from earlier? If your pH is going in one direction, your respiration rate goes in the opposite direction. That holds true here once again, okay? So this hyperventilation will be the solution for a person who's in acidosis. So if you walk in on somebody, a neighbor, a patient, they're hyperventilating, you know they're a diabetic, that may be the warning sign that they're experiencing ketoacidosis and their blood sugar may be too high at that point.